porcelain veneer really is basically just a new facing for your tooth. What we do is we skim maybe 3/10 to 5/10 of a millimeter off of the front surface of the tooth, sometimes over the edge, the biting edge of the tooth also, and then that gets replaced with a new pretty porcelain shell. But basically what we do with the veneer is if there's any tooth that's out of alignment, or say for instance we've tried to bleach the teeth and they just won't get any whiter and the patient really wants to have whiter teeth, then the only option we have is to physically change the outside characteristics of the tooth. We're able to make teeth a little wider, a little narrower, make it a little longer, a little shorter, whatever we have to do to make the smile into the work of art that we like for it to be. The process is basically in 3 steps. Consultation, we make some impressions, we do our evaluation, we do our smile design, we have several mock-ups of different setups for teeth and what the patient is after in their smile. We let them choose what they want, then we send the models off to the laboratory. They do a wax-up. Basically what that is a mock-up of what we think the teeth will look like. When we do the veneers, the patient comes back in. If they're fine with the setup and the way the teeth look, then we schedule them for the preparation appointment. And what happens during that appointment is the patient is numbed, just like we do when we do a filling. The patient gets numbed first, and then we shave off about 3/10 to 5/10 of a millimeter off the front surface of the tooth, just to right at the crest, the gum line. If we have to go in between the teeth to shift teeth from one place to another slightly, we have to take more tooth structure away, but we try to be as conservative as we can with the veneers. So we reduce the tooth structure to a certain degree in order to give us the ability to recreate the smile the way we want it to be. Then temporaries are placed after the impressions are made of the preparations on the teeth. That's sent off to the laboratory. About 3 weeks to 4 weeks later, we schedule the patient to come back, during which point they are numbed again, and then we glue the porcelain veneers into place. Porcelain veneers are one of the most beautiful restorations that we can create as dentists for patients. It's not just making a veneer, there's some artistic ability that needs to be embraced and used also in creating this smile. I want to work on people's mouths where people say, boy, you got beautiful teeth, without people knowing that they're fake. And that's what some of the materials allow us to do nowadays when we do porcelain veneers.